Most men find out they have prostate cancer when it's already advanced. Not because the disease appeared overnight, but because the signs were there for months, sometimes years, and they ignored them. That's the dangerous part. Prostate cancer doesn't scream, it whispers, and most men talk themselves out of listening. Here's the question you need to sit with right now. What if your body has already been trying to warn you, and you've been brushing it off as just getting older? Because there are 10 specific warning signs that men over 60 consistently overlook, and knowing them could literally save your life. I am Dr. Natalia de la Cruz, and if you want to keep receiving important content about health after 60, subscribe to the channel and turn on the notification bell. Now, let's get into it, because the first sign on this list catches men completely off guard. Most men assume that if something were seriously wrong, they'd feel it, they'd know. But prostate cancer doesn't work that way. In its early stages, it's almost completely silent, no dramatic pain, no obvious signal. That's what makes it so dangerous, and by the time symptoms become impossible to ignore, the disease has often already progressed. So let's start with sign number 10, painful or burning urination. You go to the bathroom and it stings, or it burns, or there's an uncomfortable pressure that just doesn't feel right. Most men chalk this up to a minor infection. They drink more water and wait for it to pass. And sometimes it does, temporarily. But here's what's actually happening inside the body. When the prostate starts to enlarge because of cancer, it puts direct pressure on the urethra, the tube that carries urine out of the body. That pressure disrupts normal urine flow and can cause real pain. It can also happen when the cancer begins to spread into nearby tissues, the urethra, the bladder, the rectum. When local invasion starts, burning during urination can be one of the first signs you feel. Now, burning can absolutely be caused by an infection, and antibiotics might calm it down for a while. But if it keeps coming back, or if it doesn't fully resolve, that's your body telling you something more is going on. Don't ignore recurring burning or pain during urination. It's not just a nuisance, it may be a signal. Sign number 9, frequent urination, especially at night. Here's a question for you. How many times are you getting up at night to use the bathroom? Once? That can be normal. Twice or more? Several nights a week? That's a pattern worth paying attention to. The medical term for waking up repeatedly at night to urinate is nocturia, and it's one of the most commonly dismissed warning signs in men over 60. Men accept it as just aging. They joke about it, but nocturia isn't something you should normalize, especially when it starts getting worse. When the prostate grows and puts pressure on the bladder can never fully empty. So it fills back up quickly. Your body thinks it's urgent. You wake up, you come back to bed. An hour later, it happens again. The sleep deprivation compounds everything. You feel exhausted, your immune system weakens, your mood suffers, and all the while, the underlying problem, an enlarged prostate or early-stage cancer, is being left unaddressed. If you're waking up 2 or more times a night to urinate, and this is happening regularly, write it down, track it, and bring it to your doctor. Sign number 8, blood in the urine. This one stops men cold, and it should. Seeing blood in the urine, even a faint pink tint, even just once, is not something to explain away. It is not something to watch and see if it happens again. The medical term is hematuria, and it shows up in 2 forms. Microscopic hematuria, which you can't see with the naked eye and is only detected through a lab test, and macroscopic hematuria, where the urine visibly turns red, pink, or brownish. In prostate cancer, blood in the urine typically appears in the more advanced stages, when the cancer has started to invade the surrounding urinary structures, the kidneys, the ureters, the bladder. Only about 3 to 5% of prostate cancer patients report visible blood in the urine, but that doesn't mean you can afford to ignore it. Even a single episode of blood in the urine demands immediate medical evaluation. Don't wait. Don't assume it was something you ate. Don't tell yourself it'll clear up on its own. Blood in the urine is a signal. Take it seriously. Sign number 7. Unexplained pain in your back, hips, or legs. A lot of men over 60 live with chronic back pain. They assume it's arthritis, a pulled muscle. the wear and tear of decades of hard work, and often that's exactly what it is. But here's the part most men don't know. One study found that men with lower back pain had a 50% greater chance of being diagnosed with prostate cancer compared to men without back pain. When prostate cancer spreads, when it metastasizes, bone is one of the most common places it goes. The lower spine, the pelvis, the hips, the upper legs. The cancer doesn't just sit in those bones, it disrupts them. It damages the tissue. It causes a deep, aching pain that doesn't behave like typical muscle soreness. It doesn't get better with stretching. It doesn't respond well to standard pain relief. Some men also report weakness or numbness in their legs, a sign that the cancer may be affecting nerves near the spine. So ask yourself, have you been dealing with persistent, unexplained pain in your lower back, hips, or thighs? Pain that doesn't have a clear cause and doesn't go away? If the answer is yes, don't assume it's nothing. See a doctor and ask about a PSA test. Sign number 6. Sudden, unexplained weight loss. You haven't changed your diet. You're not exercising more. But the weight is coming off. And something doesn't feel right about it. Unintentional weight loss is one of the general warning signs that appears across multiple types of cancer, including prostate cancer. Here's what happens. The presence of cancer in the body triggers an immune response. The body starts burning more energy fighting the disease. Meanwhile, cancer cells compete for nutrients. Appetite drops, nausea increases. Some men notice that foods they used to enjoy suddenly taste different or unappetizing. When weight loss happens rapidly, without explanation, it's a red flag. If you've lost more than 5 or 10 pounds without trying and you've been experiencing other symptoms on this list, don't wait to bring this up with your doctor. If you want a clear, practical resource that organizes all of this, the signs, the risk factors, and what to actually do about them. The Medical Guide to Avoid the Mistakes That Damage the Prostate. After 60 is available in the pinned comment below the video. Dr. De La Cruz put it together specifically for men in this situation. It's not a sales pitch, it's a medical tool. Check it out when the video is done. Sign number 5, rectal pain or pressure. This is one that almost never gets talked about, and it should be. The prostate sits directly in front of the rectum. That's just anatomy. So when the prostate grows or when cancer starts to spread into the rectal area, the symptoms can feel a lot like digestive or bowel problems. Pain or pressure in the rectum, constipation that came out of nowhere, a sudden urgency to go to the bathroom, difficulty fully emptying the bowels. Men often assume this is a gut issue. They try fiber supplements or over-the-counter remedies, and the real cause, a prostate that's growing in the wrong direction, goes undetected. If you've been dealing with new bowel-related symptoms alongside any of the urinary issues we've covered so far, that combination is worth a conversation with your doctor. Sign number 4, painful ejaculation. This is uncomfortable to talk about. Most men don't bring it up, even with their doctor, but roughly 2 to 3% of men with prostate cancer experience significant pain during or after ejaculation. For some, the discomfort starts before. For others, it can linger for more than 24 hours afterward. This happens because the prostate is directly involved in producing seminal fluid. When it becomes inflamed, enlarged, or invaded by cancer, ejaculation can become genuinely painful. Not just uncomfortable, but painful. The impact on quality of life is real, and the tendency to stay silent about it is exactly why so many men never get diagnosed until it's later than it should be. If you're experiencing pain during ejaculation and you've been writing it off, stop writing it off. Sign number 3, pain when sitting. Here's one that sounds almost too simple, but it matters. When the prostate becomes significantly enlarged, whether due to cancer or other conditions, sitting for extended periods can become uncomfortable. Men describe it as a dull pressure, a heaviness, or even a numbness in the area between the scrotum and rectum, known as the perineal region. It gets worse on hard chairs. It gets worse after long drives. Some men start avoiding situations where they'll be seated for long periods, without even consciously realizing why. If you've noticed new, persistent discomfort in your pelvic floor when you sit, especially if it's been getting worse over time, that is a symptom, not just an inconvenience. Sign number 2. Difficulty urinating. This one shows up in two different ways, and both are important. The first is hesitancy. You go to the bathroom and you stand there, waiting. The stream starts slowly. Maybe it stops and restarts. It takes longer than it should. The second is incomplete emptying. You finish, but you still feel like your bladder is full. You go back 5 minutes later, you go again before bed, and again in the night. Both of these patterns happen because the prostate surrounds the urethra like a ring around a hose. When that ring grows, because of benign enlargement or because of cancer, it squeezes the hose. Flow gets restricted. Men accept this as a fact of life after 60. They don't realize it's their body sending a message. If you're struggling to start urination, if the stream is weak, if you feel like you never fully empty, see a urologist. This symptom alone warrants an evaluation. And sign number 1, loss of bladder control. This is the one men find most difficult to admit. Because it feels embarrassing, it feels like it means something about who they are, so they hide it. But bladder control loss, medically known as urinary incontinence, is a genuine warning sign, and it affects a significant number of men dealing with prostate cancer. It shows up in two main forms: stress incontinence, where urine leaks during physical activity, coughing, sneezing, lifting, laughing, and urge incontinence, where the need to urinate comes on so suddenly and intensely that there isn't time to reach the bathroom. In some cases, this symptom is caused by the cancer itself, as it affects the nerves that control the bladder. In other cases, it's a side effect of treatment. Surgery and radiation can both impact bladder control. Research shows that roughly 25% of men undergoing prostate cancer treatment experience some degree of incontinence. That's a significant number, and it means this symptom, as difficult as it is to talk about, is something doctors hear about regularly. They're not surprised, they're not judgmental. What they are is ready to help. So let's bring this all together. The 10 warning signs of prostate cancer aren't always dramatic. They don't always show up all at once, but they follow patterns. And when you know what those patterns look like, you stop dismissing them as just getting older. Painful or burning urination, frequent nighttime trips to the bathroom, blood in the urine, unexplained back, hip, or leg pain, sudden weight loss, rectal pressure or pain, painful ejaculation, discomfort when sitting, difficulty urinating, and loss of bladder control. None of these symptoms by themselves means you have prostate cancer. Some have other explanations entirely, but any of them, especially when they persist or when more than one shows up at the same time, is a reason to see your doctor and ask for a prostate evaluation. Early detection is the single most powerful tool men have against this disease. When prostate cancer is caught early, outcomes are dramatically better. The options are broader, the risks are lower. You don't have to be scared, you just have to be informed. If you want a clear resource that walks through what to watch for, what to ask your doctor, and what lifestyle habits actually protect the prostate after 60, the medical guide to avoid the mistakes that damage the prostate after 60 is waiting for you in the pinned comment below this video. Take a look. It was designed specifically for men in this stage of life. And if this video helped you understand something you didn't know before, if it gave you one reason to pick up the phone and schedule that appointment you've been putting off, then do one more thing before you leave. Subscribe to the channel, because this is exactly the kind of content we put out every week. Honest, clear, practical health information for men over 60. No fluff, no scare tactics, just what you actually need to know. Take care of yourself. Your health is worth protecting.